Question 1. Explain 3 types of standard treatment are used. Answer. Surgery. Surgery is used when possible to treat adult brain tumor as described in the description section of this summary. Radiation therapy. Radiation therapy is a cancer treatment that uses high-energy X-rays or other types of radiation to kill cancer cells. There are 2 types of radiation therapy. External radiation therapy uses a machine outside the body to send radiation toward the cancer. Internal radiation therapy uses a radioactive substance sealed in needles, seeds, wires, or catheters that are placed directly into or near the cancer. The way the radiation therapy is given depends on the type and stage of the cancer being treated. Chemotherapy. Chemotherapy is a cancer treatment that uses drugs to stop the growth of cancer cells, either by killing the cells or by stopping the cells from dividing. When chemotherapy is taken by mouth or injected into a vein or muscle, the drugs enter the bloodstream and can reach cancer cells throughout the body. Systemic chemotherapy. When chemotherapy is placed directly into the spinal column, an organ, or a body cavity such as the abdomen, the drugs mainly affect cancer cells in those areas. Regional chemotherapy. A dissolving wafer may be used to deliver an anti-cancer drug directly into the brain tumor site after the tumor has been removed by surgery. The way the chemotherapy is given depends on the type and stage of the cancer being treated. Question 2. How are adult brain tumors treated? Answer. Different types of treatment are available for patients with adult brain tumor. Some treatments are standard, the currently used treatment, and some are being tested in clinical trials. Before starting treatment, patients may want to think about taking part in a clinical trial. A treatment clinical trial is a research study meant to help improve current treatments or obtain information on new treatments for patients with cancer. When clinical trials show that a new treatment is better than the standard treatment, the new treatment may become the standard treatment. Question 3. Explain recurrent adult brain tumor. Answer. Treatment of recurrent adult brain tumors may include the following: surgery with or without chemotherapy, radiation therapy if not used during previous treatment, with or without chemotherapy, internal radiation therapy, chemotherapy, a clinical trial of new anti-cancer drugs, a clinical trial of chemotherapy placed into the brain during surgery, a clinical trial of biologic therapy. Question 4. Explain germ cell tumors. Answer. Treatment of central nervous system germ cell tumors depends on the type of cancer cells, the location of the tumor, whether the cancer can be removed in an operation, and other factors. Question 5. Explain meningeal tumors. Answer. Treatment of meningiomas may include the following: surgery with or without radiation therapy, radiation therapy for tumors that cannot be removed by surgery. Treatment of malignant meningioma may include the following: surgery plus radiation therapy, a clinical trial of external radiation therapy plus hypothermia therapy or new methods of delivering radiation therapy, a clinical trial of new anti-cancer drugs and/or biologic therapy following radiation therapy. And question 6. Explain pineal parenchymal tumors. Answer. Treatment of pineal parenchymal tumors may include the following: surgery plus radiation therapy with or without chemotherapy, a clinical trial of external radiation therapy plus hypothermia therapy or new methods of delivering radiation therapy, a clinical trial of new anti-cancer drugs and biologic therapy following radiation therapy. Question 7. Explain medulloblastoma. Answer. Treatment of medulloblastomas may include the following: surgery plus radiation therapy to the brain and spine, a clinical trial of surgery and radiation therapy to the brain and spine for tumors that are more difficult to treat successfully, a clinical trial of chemotherapy. Question 8. Explain ependymal tumors. Answer. Treatment of grade I and grade II ependymomas is usually surgery with or without radiation therapy. Treatment of anaplastic ependymoma may include the following: surgery plus radiation therapy, a clinical trial of surgery followed by chemotherapy before, during, and after radiation therapy, a clinical trial of chemotherapy and/or biologic therapy. Question 9. Explain mixed gliomas. Answer. Treatment of mixed gliomas may include the following: surgery plus radiation therapy with or without chemotherapy, a clinical trial of external radiation therapy plus hypothermia therapy or new methods of delivering radiation therapy, a clinical trial of new anti-cancer drugs or biologic therapy following radiation therapy. Question 10. Explain about oligodendroglial tumors. Answer. Treatment of oligodendrogliomas may include the following: surgery, usually with radiation therapy, a clinical trial of surgery and radiation therapy with or without chemotherapy for tumors that cannot be completely removed by surgery, a clinical trial of chemotherapy using one or more drugs. Treatment of anaplastic oligodendroglioma may include the following: surgery plus radiation therapy with or without chemotherapy, chemotherapy using more than one drug, radiation therapy with or without chemotherapy using more than one drug. Clinical trials of new treatments. Question 11. Explain glioblastoma. Answer. Treatment of glioblastoma may include the following: surgery plus radiation therapy, with or without chemotherapy, a clinical trial of chemotherapy placed into the brain during surgery, a clinical trial of radiation and concurrent chemotherapy, a clinical trial of external radiation therapy plus hypothermia therapy or new methods of delivering radiation therapy, a clinical trial of new anti-cancer drugs and biologic therapy following radiation therapy, a clinical trial of chemotherapy and new methods of delivering radiation therapy. Clinical trials of new treatments. Question 12. Explain anaplastic astrocytomas. Answer. Treatment of anaplastic astrocytoma may include the following: surgery plus radiation therapy, with or without chemotherapy, a clinical trial of external radiation therapy plus hypothermia therapy or new methods of delivering radiation therapy, a clinical trial of new anti-cancer drugs and biologic therapy following radiation therapy, a clinical trial of chemotherapy combined with different methods of delivering radiation therapy. Question 13. Tell me why are CT scans performed? Answer. CT scans are performed to analyze the internal structures of various parts of the body. This includes the head, where traumatic injuries, such as blood clots or skull fractures, tumors, and infections can be identified. In the spine, the bony structure of the vertebrae can be accurately defined, as can the anatomy of the intervertebral discs and spinal cord. In fact, CT scan methods can be used to accurately measure the density of bone in evaluating osteoporosis. Occasionally, contrast material on X-ray dye is placed into the spinal fluid to further enhance the scan and the various structural relationships of the spine, the spinal cord, and its nerves. Contrast material is also often administered intravenously or through other routes prior to obtaining a CT scan. See below. CT scans are also used in the chest to identify tumors, cysts, or infections that may be suspected on a chest X-ray. CT scans of the abdomen are extremely helpful in defining body organ anatomy, including visualizing the liver, gallbladder, pancreas, spleen, aorta, kidneys, uterus, and ovaries. CT scans in this area are used to verify the presence or absence of tumors, infection, abnormal anatomy, or changes of the body caused by trauma. Question 14. Explain diffuse astrocytomas. Answer. Treatment of diffuse astrocytoma may include the following: surgery, usually with radiation therapy, a clinical trial of surgery and radiation therapy with or without chemotherapy for tumors that cannot be completely removed by surgery, a clinical trial of radiation therapy delayed until the tumor progresses, a clinical trial comparing high-dose and low-dose radiation therapy. Question 15. What is medical assistant? Answer. A medical assistant, MA, is an unlicensed person who assists in the medical practice under the supervision of a physician, physician assistant, or nurse practitioner and performs delegated procedures commensurate with the MA's education and training. An MA does not diagnose, interpret, design or modify established treatment programs or perform any functions that would violate any statute applicable to the practice of medicine. MAs are not licensed nor regulated in Arizona.